Female genital mutilation, sometimes called female circumcision, is a dreadful procedure involving partial or total removal of the female external genitalia or other injury to the female genital organs for non-medical reasons. FGM is usually performed on girls between birth and 15 years of age. There are four major types of FGM, referred to as type 1, 2, 3, and 4. Type 1 consists of partial or total removal of the clitoris. Type 2 involves the clitoris and the labia minora being removed. This also may include the removal of the labia majora, commonly called the outer lips. Type 3 is the most severe form, leaving only a small opening for urine and other fluid. Type 4 is a procedure of the genitalia of women for non-medical purposes, such as pricking, piercing, and scraping. Any broken instrument such as broken glass or razor blade is used. No anesthesia is given as the women performing the procedure typically have no medical training. Gloves are not worn and hands are not washed. I'm not going to go into detail about the procedure as we all can use our imagination and understand the fear these girls are going through. FGM is practiced to control a woman's sexuality and to help her remain pure before marriage and for hygiene reasons. The countries in red indicate that over half of the women in these countries had the procedure done, followed by the countries in orange and then yellow. So now that you have some knowledge about FGM, allow me to explain how this affects North America. FGM is a growing epidemic in the United States and Canada. The number of girls at risk for FGM in North America has more than doubled in the past 10 years. More than 500,000 women and girls in the U.S. are at risk for undergoing FGM. Immigration to the United States from African and Middle Eastern countries is the sole factor in the rise of numbers. But don't worry, I'm pretty sure that by now you're thinking, this is appalling, but it really doesn't affect me. Well, California is the state with the largest number of at-risk women and girls, followed by New York and Minnesota. The U.S. Congress passed a law in '96 making it illegal to perform FGM in the United States and punishment by up to 5 years. In the past several decades, Congress have made numerous changes to the U.S. immigration laws to offer better protection for immigrant victims of domestic violence. The Victim of Trafficking and Violence Protection Act of 2000 introduced a U visa, which allows a non-citizen to work and live in the United States to assist in the investigation of a criminal offense. In 2013, President Obama signed a law making it illegal to knowingly take a girl overseas to perform FGM. Despite all the laws, enough still isn't being done to protect these girls. 27 states still don't have laws against FGM, and these states are shown in gray. This is child abuse, people. Why don't every state have laws against this? And to make matters even worse, the states in blue don't have harsh punishments at all. The max you would serve in California is 6 years, 4 in New York, and life in Minnesota. California and New York are ranked highest in FGM cases and yet have one of the lowest punishments. Awareness and, of course, better laws will help stop this global issue. Some states offer FGM Awareness Week to educate and bring more awareness to this growing epidemic. The reason I had you complete the worksheets prior to watching this video is because a lot of people don't realize how this issue affects America. They think it's an issue only in other countries, but it truly affects this country, this state. It affects me, and now, you.